I'd like to turn it over, to Kashif, because I know that, you fund a lot of women entrepreneurs. And it's something that, is not only, as Colin was saying, we need those indicators in order to move forward. And we need to know where we are right now in real time and how we can improve it. So I'd like to, turn it over to you into some of the work that you've been doing for women entrepreneurs on the ground, and really some of those financing, and how do we move to concrete actions with the G7 announcement.
Great. Thanks so much, Joanne. Thanks, everybody. I think, this is a room that is already converted in terms of everybody's talking about the same things, and everybody seems to be on the same page of why investing in women is a priority and should be a priority, and, how we need to sort of, continue to do that. And, how do we look at new avenues? So that's that's a great thing. I mean, looking at women and looking at access to opportunities for women, we know that women lack the access to opportunities. We know that last year, the economic recession that's happened, it's been called the C-cession, which means that more women have been adversely impacted than men, even though, of course, both genders have been impacted. So, why we need to do this is very important. Usman mentioned health indicators, and, having one of the worst maternal mortality rates, one of the worst infant mortality rates. The time for action is now. But I think what is important now, and what is important in this discussion, is that it has to be a sustainable effort. And we had Jasper also talking about the same thing. We had our other colleagues also talk about the same thing, that the woman entrepreneur needs to have an income stream from this, right? So our model at Gush is we don't focus specifically on health interventions or healthpreneurs, as we'd like to call them, but we look at entrepreneurs, women micro entrepreneurs, and we give them access to finance so that they can actually create sustainable businesses where they can earn the income, they can expand, their businesses in coming years. They can repay our loans, and they can also invest in the development of their households. And so Kash's approach is not just a microcredit approach. We look at it from different angles. So not only do we provide access to microfinance loans, we also provide access to opportunities for capacity building. These include business development trainings, financial literacy trainings. We also link our clients up to a very women-centric health insurance program, which, as our colleague from the WHO mentioned, is very important. So if you just look at the numbers, we have about 106 million policyholders from low-income families right now with our health insurance program. And we have a 70% utilization ratio, which really is the important bit, because you see so many government programs, so many other programs with large numbers, but what is the utilization looking like? And then when you look at the claims that have been processed, what you see is 70% of the claims by value and by number are by women. So, these things they're very important, because you can't really give access to finance in isolation. So what we've seen as a result of our program is that we've been able to raise incomes for low-income households. We've been able to help women access better healthcare facilities, actually be able to access healthcare facilities that are high quality. A lot of the women that I've met that have used our insurance have basically told me that we've been waiting to get this surgery done. So, access to healthcare is not the first thing that they think of when they, earn income. There are so many other priorities, and because, women are generally sort of tend to deprioritize on the Maslowian hierarchy of needs. Their needs are really not that highlighted. So, I've met women who said that, we had this issue in our uterus for years, but we never got it treated because we didn't have access to good doctors, and the health insurance has actually helped us do that. So, it's very important to look at a model actually have revenue streams for the women that are going in the community. And only then you'll be able to sustain that, because, then you'll have women actually invested in providing good services, women actually caring about referrals, women practitioners, these healthpreneurs or these women workers, where they can actually provide the quality because they can charge money for it. As our colleague from the WHO was saying, that, these trainings need to be high level, they need to be accredited, they need to be, accredited not just by the WHO, but also by national bodies, so that there's credibility in the services that they're providing. access to finance is an important piece of the puzzle because, as we know, women are largely underserved across the world, specifically in Pakistan. If you were just to look at Findex numbers for 2017, what you'd see is only 7% of women in Pakistan actually have a bank account, compared to about 21%. So 35% for men and 21% generally for Pakistan. So access to finance would have to be key. But of course, you need to supplement that with capacity building, then helping them do the forward and the backward linkage. So the backward linkage is what the social enterprise will do, but how about the forward linkage? So, how do we connect them to tertiary care? How do we connect them to secondary care in terms of, going to hospitals? Then, can we also look at telehealth? So you have the woman out there, and then, she's connected at the back end, as Usman was mentioning, with the social enterprise to experts. So, they can, so it doesn't end at identification. So, oh yes, we can identify this is a problem, but what do you need to do about it? Where do you need to go? And I think that would be really, really important in ensuring the success of a pilot in this scope and in this field.